Hello, professor and class. This is week 5, our video discussion. We have here an 86-year-old female presenting to the ED with the caregiver for weakness and not acting right. She has a history of dementia, hypertension, and CHF. And the caregiver says that the patient is usually alert and oriented to self and place and people, but is disoriented to time with a short-term memory issue. Uh, So, based on the case above, I do feel that all the tests that are pending are appropriate. For instance, the EKG, the troponin, and the BMP are being done because of the history of CHF and hypertension. An EKG um, can show if there's any kind of change in the heart, if there's any kind of ischemia or any damage to the heart, which is a possibility in this case. The troponin levels allows doctors to diagnose things like a heart attack or any heart-related condition. Troponin levels can be acutely elevated and chronically elevated. In the conditions such as CHF, that can cause already a high troponin level. And it can also be a reason why she's having a change in her mental status as well. For the BMP, with heart failure, the heart makes two proteins, the B-type natriuretic peptide and N-terminal pro-BMP. Both of these levels go up when your heart failure gets worse and go down when it gets better. So it's good to know if it's elevated, that means her heart failure is getting worse. For the CBC with differential, this test measures specifics of your white blood cell count, plus all of your blood cell levels, including red blood cells and platelets. So with this test, we might want to know if she's having some kind of infection. If the white cell counts are up, she could be having some kind of infection, and thus the altered mental status. For the BMP, it's normally ordered when there's an electrolyte imbalance, abnormal blood sugar, or to see how well your blood is being filtered. It's good to know what her electrolytes are looking like, especially since she has the dry mucous membranes and the decreased skin turgor. And as well, she's on that Lasix 40 milligrams daily. For the LFTs, the liver function tests help determine the health of your liver by measuring the levels of proteins and liver enzymes and bilirubin in your blood. So symptoms of liver issues include weakness, fatigue, weight loss, abdominal pain, which this patient has experienced most of those things. For a type and screen, most EDs use that as a protocol just in case any critical lab values come back and they need a blood transfusion. That's already out of the way. Chest x-ray is also pretty much a standard for everyone, especially someone like this patient that has all these heart conditions. The chest x-ray can also reveal fluid in or around the lungs. And in her case, she does have history of CHF, and she got that 2-liter bolus of normal saline in the ED. So there's a possibility she could be now in fluid overload. So a chest x-ray would be really beneficial. For the CT head without contrast, the most common indication for a CT head without contrast would be altered mental status, CVA, head injury, headaches, or seizures. With this patient having that new onset in the mental status change, I think it's appropriate to do a CT just to rule out, any bleed in the brain, CVA, anything like that. Urinalysis is frequently used to test for the evaluation of potential UTIs. In older people, the number one symptom is altered mental status. So definitely urinalysis and urine culture is a must for a patient this age with altered mental status. So I definitely think that's very appropriate. Lactic acid levels are high. Most often it's because you have a condition that makes it hard for you to breathe enough oxygen, which includes sepsis, heart attack, CHF, severe lung disease or respiratory failure, fluid buildup in your lungs, or severe anemia. These are definitely all possibilities for this patient. Last but not least, we have the blood culture. Culture should always be requested when a bloodstream infection or sepsis is suspected, such as in meningitis, endocarditis, pneumonia, pyelonephritis, or intra-abdominal suppuration. So like I said before, there is a possibility of an infection, so might as well go ahead and do a blood culture. So This is my week 5 video discussion. I hope you guys agree and enjoy. Thank you.